Colon cancer is the third most common cancer diagnosed in people in the U.S., according to the CDC. The American Cancer Society has estimated that about 1 in 23 men and 1 in 25 women will develop colorectal cancer during their lifetime. It is also a serious health concern affecting millions worldwide. Colon cancer is a type of cancer that starts in your colon, also known as the large intestine or the rectum. It's important to be aware of these 10 early warning signs, as early detection can significantly improve outcomes. Let's dive in. Number 1. Change in bowel habits. A noticeable change in your regular bowel habits can be an early warning sign of colon cancer because it often indicates disruptions in the normal functioning of the digestive system. Changes may include persistent diarrhea, constipation, or shifts in stool consistency. While occasional variations can be normal, any sustained changes over several weeks should be brought to the attention of a healthcare professional. It could indicate an underlying issue that needs further evaluation. Number 2. Blood in stool. The presence of blood in the stool, whether it's bright red or a darker tar-like appearance, is a crucial red flag that should never be ignored. While the cause could be from hemorrhoids or anal fissures, it is also a symptom associated with colon cancer. In colon cancer, bleeding can occur when a tumor in the colon or rectum grows large enough to cause damage to nearby blood vessels. As a result, blood may mix with stool, causing it to appear red or maroon in color. However, in some cases, the blood may be occult, in which case it can only be detected through tests that check for blood in the stool, such as fecal occult blood tests. If you notice this symptom, it's vital that you consult with a doctor promptly. Number 3. Abdominal discomfort. Persistent abdominal discomfort, such as cramps, distension, bloating, or pain in the abdominal or bowel region that persists for more than a few days without relief, can be a sign of colon cancer, especially if it's accompanied by other symptoms. It's important to note that these are common issues that can also be caused by a number of conditions, such as diet-related gastrointestinal distress, Crohn's disease, or ulcerative colitis. Women can sometimes dismiss symptoms like abdominal discomfort because they can feel similar to menstrual symptoms. If these symptoms linger or worsen over time, it is essential to seek medical advice. Number 4. Unexplained weight loss. Unintentional and unexplained weight loss, especially if not attributed to changes in diet or exercise, can be a warning sign of various health conditions, including colon cancer. Significant weight loss can be a result of the body's response to the disease. Cancer cells consume a lot of energy, which can lead to changes in the body's metabolism. This increased metabolic activity can result in the breakdown of muscle and fat tissue, leading to weight loss. Some individuals with colon cancer may experience a reduced appetite or feeling full after eating only small amounts, which can lead to a decrease in calorie intake, contributing to weight loss. Colon cancer can also affect the absorption of nutrients from food in the digestive tract. If the cancer obstructs the colon or impairs its ability to absorb nutrients, it can result in malabsorption and weight loss, even if the individual is eating normally. Number 5. Narrow stools. Thin or narrow stools, often described as ribbon or pencil-like, can also be a sign of colon cancer. This change in stool size is significant because it might suggest a partial obstruction, possibly caused by the growth of a tumor. Colon cancer typically develops from precancerous polyps or abnormal growths within the colon. As the tumor grows larger, it can narrow the lumen of the colon, restricting the passage of stool. This can result in stools that are thinner than usual. Initially, the change in stool shape may be subtle, but it may become more noticeable and persistent as the tumor progresses. Narrow stools are often accompanied by other symptoms of colon cancer, such as changes in bowel habits, rectal bleeding, or abdominal pain. If you're getting value, let me know in the comments. Number 6. Fatigue. Chronic fatigue or weakness that persists despite adequate rest and sleep can be a symptom associated with colon cancer. Cancer-related fatigue can be debilitating and impact daily activities. Extreme tiredness is a nonspecific symptom, but happens to be very common in people with more advanced cancers, such as stage 4 colon cancer. Cancer fatigue differs from ordinary fatigue in that it's not usually relieved by rest or counteracted by a good cup of coffee. It's not uncommon for a person to have a sense that something is amiss in their body, even if they don't have specific symptoms to back up that feeling. Trust your intuition. If you are concerned that something is wrong, make an appointment to talk with your healthcare provider. Number 7. Iron deficiency anemia. Colon cancer can lead to chronic bleeding, resulting in iron deficiency anemia. Anemia is a blood disorder that is characterized by a deficiency of red blood cells or hemoglobin. Iron is essential for the production of hemoglobin, and when the body loses blood, it also loses iron. Depending on the location of the bleeding within the colon, anemia can be the first sign that blood loss is occurring. Symptoms may include fatigue, weakness, pale skin, dizziness, increased heart rate, shortness of breath, and irregular menstruation. If you experience these signs, it's crucial to undergo blood tests to check your iron levels. Anemia can have various causes, and identifying the underlying reason is essential for appropriate treatment. Number 8. Bowel urgency. Feeling a persistent and urgent need to have a bowel movement, especially if it's not relieved after passing stool, can be another indicator of colon-related issues. While bowel urgency is often associated with conditions like irritable bowel syndrome or inflammatory bowel disease, it can also indicate a more serious underlying issue such as colon cancer. Colon cancer can develop anywhere in the colon or rectum. When a tumor grows in certain areas of the colon, particularly in the lower part near the rectum, it can irritate the surrounding nerves and tissues. This irritation can lead to a sensation of urgency as the body's natural response to try to expel the obstruction or abnormal growth. In some cases, colon cancer may partially obstruct the colon, limiting the passage of stool. When this occurs, the body may interpret the presence of stool against the obstruction as a sign that a bowel movement is urgently needed, resulting in bowel urgency. While occasional bowel urgency may not necessarily indicate a serious problem, persistent or recurrent symptoms should not be ignored. Number 9. Incomplete bowel movements. Difficulty in emptying your bowels completely, or a sensation that there's something left behind after a bowel movement, should not be dismissed. Colon cancer can lead to obstruction or narrowing of the colon or rectum, making it difficult for stool to pass through. When the tumor blocks the passage partially, it can result in a sensation of incomplete evacuation after a bowel movement. It can feel like there is still stool left in the rectum, even though you have already attempted to have a bowel movement. This can lead to straining during bowel movements, which may exacerbate the sensation of incomplete evacuation. If the sensation of incomplete evacuation persists for several weeks, it's important to seek medical evaluation. Number 10. Gas or cramps. While gas and cramps are more commonly associated with other gastrointestinal issues such as irritable bowel syndrome or indigestion, persistent or severe discomfort could be indicative of an underlying issue such as colon cancer. As a tumor grows within the colon, it can cause changes in the normal functioning of the digestive system. Tumor growth can lead to disturbances in the passage of gas and stool through the colon, resulting in increased gas production and discomfort. Additionally, if the tumor obstructs the colon partially, it can cause cramping as the muscles of the colon contract to try to push stool past the obstruction. While occasional gas or abdominal cramps may not necessarily indicate a serious problem, persistent or recurrent symptoms should not be ignored. Recognizing these 10 early warning signs of colon cancer is crucial for timely diagnosis and effective treatment. If you or a loved one experience any of these symptoms, it's essential to seek medical attention promptly. Remember, early detection greatly improves the chances of successful treatment and recovery. Also, it's important to prioritize regular checkups and screenings. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and hit that subscribe button for more health and wellness content. Stay healthy, stay informed, and until next time, take care of yourself.